necessarily reflect the views of the Department of Justice. The Institute for Coordinated Community Response is a program of the Conference on Crimes Against Women. We provide national training. We have monthly webinars, which are live 90-minute trainings such as today, focusing on domestic violence. We have on-demand learning. We have multi-part roll call video series geared towards law enforcement. It's self-paced e-courses. We also have our Cause Summit Beyond the Bounds, which we'll discuss a little bit later at the end of the webinar. It's a 2-day conference in South Padre Island. We also have a resource library full of webinar recordings, videos, fact sheets, articles, and more. The Institute for Coordinated Community Response works alongside rural communities to improve their systemic response to domestic violence. Today, we are joined by Dr. Shani Collins-Woods, BSW Program Director and Associate Professor of Austin Peay State University. And I'll stop sharing and let Dr. Woods take it over.
Okay. Okay. Can you all see my screen?
Yes.
Okay. So good afternoon, everyone. It is so nice to meet with you all virtually. And I am Dr. Shani Collins-Woods, the Associate Professor of Social Work at Austin Peay State University, as well as the BSW Program Coordinator or Program Director. So for many years, I've been in social work education, and I am excited to join you all today. And before I begin, I would like to thank the Institute for Community Coordinated Care. I would like to thank Maya as well as Lacey for the opportunity to share with you today. And when I share and present, I like to think of it from the perspective of co-learning. So thank you so much for the important work that you are all doing to advance our responses as a collective to intimate partner violence and to address these issues in particular among individuals living in rural communities. So thank you for being here today. Before I tell you a little bit more about this presentation, I want to tell you why I became interested in intimate partner violence. I am from a rural community in the Mississippi Delta, Greenwood, Mississippi, which is often thought of as the home, one of the homes of the blues. And so when we start thinking about intimate partner violence, we often think about people being sad who are living with this chronic issue every day in their lives. And so my presentation will use more vibrant colors because I didn't want us to think about this from a sad, woe is me perspective, but I want us to put our collective thinking hats on to really think about impactful solutions, community-based, survivor-forward solutions. And so this is about the survivors. This is about the important work that we all contribute to the various communities that we serve. And so, again, I became interested in this because I am from a rural community, but also when I was a student at my college in Mississippi, there was unaddressed intimate partner violence among some of the women that I saw. And also as a social work educator, I have seen students come into the classroom with physical signs of abuse, or they are wearing it and you can see that outward manifestation. And so in 2017, I wrote a book called Healthy Love 365, which addresses healthy boundaries in relationships. And I also have published in this area and continue to really use my research in social work and my background to champion issues around femicide and really ways that those of us in the social work community, how we can address these issues. And here you'll see information about me. I'm a graduate of the University of Alabama School of Social Work, site visitors, so forth and so on. So today, again, we're going to be talking about ways to prevent IPV. We're going to be discussing and uplifting intersectionality and its complexity, as well as highlighting some trauma-informed interventions. I also want to talk a little bit briefly about research and how we, as this collective of coordinated community members, can actively respond. And also I want to uplift ways that we can highlight policy interventions to impact change for survivors. Again, this is going to be the outline of our presentation. So part one, understanding rural intimate partner violence. I'm a social worker, and when I educate my students who are in direct practice on intimate partner violence, I tell them to remember violence, domestic violence, intimate partner violence is about two things. Get this acronym, PC, power and control. So we know from our understanding and our training that IPV can look like physical violence, psychological, sexual, economic. And some of those manifestations in the physical arena look like physical hitting, pushing, the use of weapon, choking. Psychological. It can look like isolation from family members and friends and support systems. In the economic realm, it can look like sabotaging one's employment, controlling finances. And in the sexual area, it can look like assault, reproductive control, or coercion. Intimate partner violence is a prevalent issue. And when I contextualize IPV or domestic violence, I contextualize it from the perspective of the American Public Health Association that suggests that IPV, it is a public health issue. So it is not just an issue that occurs in the home. It is an issue that we should be addressing to the same extent that we would address the issue of, food insecurity or the issue of homelessness. Intimate partner violence deserves that same level of attention, that same level of support from our communities as well as from our government. And so when we start thinking about it, there are not many differences as it relates to the prevalence of it in rural and urban areas, but there are some specific differences when we start thinking about rural locale. For example, in rural communities, there is a greater severity of physical abuse. Again, we talked about the physical punching, the hitting, okay, that type of physical abuse. There's a higher use of weapons when it comes to dealing with IPV among women in rural areas. Also, there's a more chronic pattern of abuse. When we think about anything that is chronic, think of it in terms of like an issue like living with diabetes. We all know someone who may have high blood pressure or diabetes. And so it's a chronic issue that they have to maintain every day to keep their wellness, right? So when we think of chronic patterns of abuse, that means something that a woman or an individual living who is in a violent situation, they're dealing with this abuse on a chronic basis, a very persistent basis. Can you imagine? And also there are higher fatality rates as it relates to individuals who are in rural areas. So let's look at the geographic landscape of rurality in the United States. About 44.1 million individuals live in rural areas. And so when we start thinking about domestic violence, there is a lack of services within individual counties. And so the average county, 42%, there's a large disparity. So of those rural counties, many of them lack domestic violence services within their county borders, so 42%. Also, when it comes to addressing this, perhaps through law enforcement or reaching the hospital, and I'll say in particular, probably the next service provider, the average time to the next service provider is often a 75-minute drive, or it takes a significant amount of time for an individual who is facing domestic violence or living with IPV. If they're trying to receive assistance, it's on average going to take them about 75 minutes to receive that assistance. So what are some unique barriers that are facing individuals who are living in these rural areas? Okay. Well, some of those issues are no different than issues in urban areas. But for example, there may be issues related to transportation. And in social work, we would consider this to be a psychosocial issue, right? There is a greater amount of distance that an individual would have to travel to seek out services or support services. Non-existent or unreliable cell phone coverage. And what this means is that the cell phone service may not necessarily work if a person is trying to call 911 or seek out social support services. Also, for example, I'm from a small town And if the weather gets too bad, they start to shut down certain areas. And so you may have to travel like on those county roads to get to the next area or to get to the location that you are trying to travel. And also there's difficulty with assessing EMS services, and also there would maybe extended response times. So also let's look at some of these unique barriers within the context of a person's social life. Being a person from Mississippi, I understand rurality quite well. I am from a county that has about 30,000 individuals, all right? And in the area I live now in Middle Tennessee, it is quite rural. So walking into the Walmart means that everyone's going to be saying hey to you, coming up to you, and just really wanting to chit chat. And so the same goes for our individuals who are living with the threat of IPV. There is a lack of privacy. Everyone knows everyone, and this often creates difficulty as it relates to confidentiality. Survivors are often reported when they go see they're seeking out social support services, because someone may say, well, hey, I saw Jane down at the local center. Is something going wrong? And where Jane may have wanted this level of privacy. The fear of gossip. Information certainly travels fast in small communities. I'm pretty sure some of you know that. And in your work that you do with those rural communities, you know that that information travels quite swiftly. And so sometimes survivors can fear public exposure and judgment when they are seeking help. And also interconnected relationships. The sheriff is friends with my husband. And, you know, if I'm trying to leave this abusive relationship, that's my husband's cousin, or that's my husband's brother, or whoever, however the situation may be. And so these relationships can undermine confidence in the judicial system, as well as help seeking services. Also, there are other barriers that women and individuals who are living with IPV face, such as cultural barriers. When you are from rural communities, oftentimes when there's a farming community, like my family is a family of small farmers, there's pride in being independent and self-reliant. But sometimes when individuals are in need of those services, it can present a great barrier. Also, the notion that what happens in this family stays in this family is very pervasive when we start talking about and discussing and understanding the challenges that our rural individuals are facing when trying to get to safety. Traditional gender roles that say women should be doing this and men should be doing this, and roles that uphold the system of patriarchy that often disempower the voice within the family, disempowers the children's voice. Generational ties to land and community can often create barriers to seeking care. And often this notion of there's a distrust of outsiders. I don't know these people. They're not going to be in my business. I don't feel safe telling anyone about this abuse or what I'm experiencing in my home. Resource limitations in rural communities. 61% of rural counties lack access to domestic violence shelters. That's a big gap. Legal aid scarcity. 75% of rural counties have fewer than one legal aid attorney per 10,000 low-income individual residents. And so that means that not only are individuals needing to find safety, not getting the resources that they need, it also means that those attorneys are quite overworked. Mental health deserts. When we think of a desert, we mean there's lack, there's scarcity. We think of this in terms of food deserts, which we often see in rural communities where there's not a local grocery store, there's no organic food market like perhaps we might have in Nashville, which is not too far from where I live. But in my rural community, like where I'm from in Mississippi, there's a Piggly Wiggly, there's a Big Star grocery store, and there's a lot of Dollar Trees and Dollar Generals. And so often, as it relates to food insecurity, there's also mental health deserts. There are no really practicing psychiatrists, and limited perhaps social workers, and those mental health professionals are just not available to the same extent that they would be available in urban communities. So here's a case study that I want you to ponder. And again, Demaya is going to address our questions at the end. So I'll read this briefly. Sarah lives on a cattle ranch 43 miles away from her nearest town. Her husband controls her only vehicle and monitors her cell phone. The closest shelter is nearly 90 miles away. The local sheriff is her husband's cousin, which we just talked about. She has 3 children and no independent source of income. If you were to address this, and you can put this answer in the chat, what your thoughts are. What barriers exist for Sarah? What resources might Sarah need to leave her situation? Keep in mind, every rural locale is quite different. Rural Minnesota may look different than rural Texas, right? So every geographic region looks quite different. And so the issues, while all rural, may differ from region or locale to locale. So keep those things in mind. What are Sarah's barriers, and what do we need to ensure that she is psychologically, emotionally, financially safe? Part 2, let's look at the intersectional impacts on rural IPV. Understanding intersectionality, and you may have heard this term before, and it was coined by legal research scholar Kimberly Crenshaw. And in a nutshell, it says that we all have intersecting identities that impact multiple factors of our lives. And some of those things include discrimination and privilege. And for rural IPV survivors, those factors compound their vulnerabilities and create barriers to safety. Again, a barrier is a blockage, right? We want opportunities to exist. And that's why you're on this call, because you are using your skills and your knowledge of this topic to create opportunities and to reduce the barriers. So race and ethnicity in rural IPV survivors. Some quick stats. Hispanic and Latina women often face language barriers and immigration concerns. Native American women experience IPV at higher rates with complex jurisdictional issues on tribal land. Black women navigate both racism and sexism when seeking help. And immigrant women in agricultural communities often face threats of deportation. Keep this in mind when you are working with diverse communities. Native American and tribal judicial complexities, and there are many. Often, Native American survivors face a lifetime of intimate partner violence. 84% of Native American women experience violence in their lifetime. That's almost all women. 97% of the perpetrators are individuals who are non-Native. And there are also service gaps. So there's a need for them to receive services within their community, but there's a 38% service gap. And so these things are important when we are understanding the context of intersectionality and how these individuals impact specific communities. Poverty, we all know what poverty is. And we all know that when we are working with rural communities, one of the main issues our communities face is economic insecurity. So there are higher poverty rates in rural areas, limited resources with livable wages, a lack of affordable housing exists, greater food insecurity, meaning that the individuals who are living in rural communities often lack access to healthy, nutritious meals. They don't have organic or farmers markets. And sometimes they do, but the mileage in between, it often creates a barrier. And often individuals who are living in rural communities face insurance barriers and gaps with access to healthcare. Also, economic entanglement is a big pronounced issue within agricultural communities. Do you know any individuals who are trying to perhaps divorce in a safe, responsible way, but they're dealing with an issue around land? And coming from a family who has ties to land ownership, and when the elders start to depart, you know, the family kind of falls apart. So can you imagine how this plays out when couples are trying to peacefully resolve or peacefully go their own way, and perhaps one person is saying, you know, this is my land, you married into this family, you're abusing me, but I need you to get off my land. And this other person is saying, I'm not going anywhere. So these are some of the issues when we start talking about rural communities. The joint ownership of land creates a barrier, land, livestock, and equipment. Who gets what? And I'm going to fight to the end. And if a person is an abuser, you already know that's about power and control. Seasonal income flows. Well, if it's a rainy season or if it's not a good season, there's no money coming in, and that creates tension in the household. Multi-generational family property with emotional and cultural significance. I'm not moving off this land. You and the kids have to go because this is my land. It holds emotional significance to me. Or even the fear of leaving. Perhaps a person may be saying, a woman may be saying, I've been here my whole life. I wanted my kids to live here. And so I want you to go and let me stay here and let me move on with my life. But there's power and control there, and limited alternative housing within the community. Issues also come up and that are important for the faith community to address include sometimes religious teachings emphasize the preservation of marriage at all costs. Whatever you do not divorce. Whatever you do, stay married. And so sometimes that creates a big problem. Oftentimes it does create a big problem. The submission of wives. Don't leave your husband. Stay in this relationship. Stay at all costs. And so we have to be a part of some of this re-education, this retraining. And it doesn't mean if you're a person of faith that you leave that alone, but it also means how can we look at things from a different framework? And if a person does not have a faith orientation, how can we still provide support? Community resources, faith leaders can be trained in IPV in their responsiveness and in how to create safe spaces for survivors. And spiritual healing, faith communities should offer long-term emotional support and address the trauma around abuse that occurs. Issues as it relate to the Two-Spirit LGBTQIA plus communities. Often this community faces isolation in their support networks. So there's a greater stigma living in rural communities. And often this is associated with high religiosity, high spirituality, and fewer LGBTQIA plus specific resources are available in rural areas. And many individuals simply are not trained to service the LGBTQIA plus Two-Spirit community. There's a risk of being outed when seeking services. And also there's isolation from this community. So if you are working, thinking about intersectionality, keep this in mind. Issues around poverty, issues around race, issues around sexual orientation are going to be important for you to have an awareness of that and how to help. Disability services. Okay, my parents were disabled before they left this earth. And so I believe that all organizations should have a pronunciation or understanding of supporting individuals who live with disabilities. So rural residents experience disabilities at higher rates of IPV with fewer accessible services. So an individual can be disabled in their home and be facing physical assaults, emotional, psychological abuse, financial abuse. Limited accessible transportation options exist in rural geographic locations. There are few ADA compliant shelters with accommodations. Also, there's a lack of resources for ALS interpreters, materials in alternative formats. One thing I've been trying to do as an educator is to learn American Sign Language. And you may have knowledge of this, but there are many free resources available at different universities across the world where you can take a class for a couple of weeks or take a sign language class. This will help you better serve this population. And also there's a higher dependency on caregivers who may also be abusers, because keep in mind, those who help us can also harm us. And we want to make sure that the individuals we serve are not being harmed. Immigration status. And we know that immigration is a hot button issue within our country and across the world. But undocumented survivors of IPV often face threats of deportation. It is used as a control tactic in the home. So rural communities have higher concentrations of immigrant workers with limited legal protection. Their language barriers are more pronounced with fewer interpretive services. And also there's limited understanding of the Violence Against Women Act, US visa laws, and self-petition and what that means in the context of being safe. So how do we, as members of this coordinated community, right? All of you are great. I see almost 284, 85 of you here. We can recognize how the different aspects impact a person's life, how the different aspects of an individual's identity can be impacted, how it is all IPV correlates or intersects across their lives. We can center the voices of our survivors, right? As we seek to help, we don't want to just push our thought process forward, but let's center their voices. We can evaluate our programs. Are they really effective? What is the impact? Okay, so program evaluation is going to always be important to the work that we are all doing. And we can work together, all 284 of us work together to build diverse partnerships to address IPV head on. What you can do also in your community, consider asking questions within a group context. What intersecting factors create vulnerabilities for the survivors in your areas? So ask yourself that and ask the survivors to come to these meetings to give their voice because unfortunately, they may be the experts in this issue, but they can use that negative experience that occurred or perhaps is occurring to advance research and to advance grant writing, to advance the need and the understanding for social supports in communities. So what populations might be overlooked in the current service provision? Who are we missing? What are their unique needs? And what community resources exist that could better address these intersectional needs? Part 3, trauma-informed, culturally responsive approaches. We all understand trauma sensitivity, being trauma informed. And what that essentially means is that we all come from diverse backgrounds. No one can walk through this life and say, I absolutely 100% have not experienced a hardship, right? We all have had hardships, and we know that we start thinking about that ACEs scale, adverse hardships. And so those things, that trauma that we perhaps all have experienced, whether it's a little bit of trauma or for some individuals, perhaps a lifetime of trauma. What is that impact and how does that impact a person's ability to reach out for help, their ability to access services? And as a provider, it's important for you to have this trauma lens and to be trauma informed. And there's so many opportunities for you to just take a free training and just to become more trauma sensitive. And so that when we are responding to our IPV survivors, we're responding more so from a trauma informed, trauma sensitive lens versus saying, well, why aren't you just leaving? Why don't you just get out of here? We need to understand that some generational things may be occurring, or there is some trauma there that is holding a person to a particular area. So safety is going to be important. It's important for us to look through this in the context of being trauma informed because we want our survivors to feel safe in their interactions with us, but also in the environments that we are working in, right? We want to create physical and emotional safety for them throughout each and every interaction because you are working with individuals who perhaps have been dealing with physical battery, emotional battery, financial abuse, all these sexual abuse. So safety is going to be paramount. Trustworthiness. Do they feel they can trust you? Do your survivors feel they can trust you, right? Can they trust you with the information they are sharing? So how do you develop trust and rapport? You come across friendly, open, being willing to listen, active listening, use those skills that you already have, and set those clear expectations as well as boundaries. And so if your organization doesn't provide funding, don't tell the survivor, hey, come over here. We have $500 waiting for you. Redirect them. Choice. Prioritize the survivor's autonomy. Hey, just because a person is leaving an abusive situation, it doesn't mean that they don't have autonomy, right? Empowerment. Help them to understand the decision-making power that they hold. And collaboration. As opposed to us putting our perspective always forward, work alongside in a collaborative way with our survivors to help them direct their own paths and to be engaged in making that individual change within their lives. And empowerment, again, fostering and shoring up their strengths to help them escape these abusive relationships or to leave these abusive relationships. So again, this leads us to culturally responsive practice. And in the work that you do, how can you be more culturally responsive? Well, this starts with recognizing that cultural context does shape our perceptions of abuse, right? Someone, and we talk about this often in social work as it relates to doing things such as spanking. Sometimes culturally, some communities believe that spanking a child if they made a mistake or if they've done a behavior that is not appropriate, that behavior is culturally acceptable. And sometimes, to the same extent, some individuals culturally may not know that, physical battery is not necessarily is never okay. Physical battery or abuse is never okay because it has been normalized within that culture or normalized, and that trauma has been normalized within a particular community. So understand that culture shapes a person's perception of abuse. And it could even be that grandmother experienced it and grandfather experienced this abuse, and this financial abuse has just been taking place for years and no one's ever said anything. So these things shape and color the individuals we work with. So we can integrate cultural strengths and resources into safety planning and help individuals understand that, yes, your culture, your values are important, but we also want you to be safe. So we can also work with our survivors to adopt models that fit cultural norms while promoting safety. Safety has to be championed. And also by providing language appropriate materials and resources, this will help our survivors and help us as we work with culturally diverse populations. So again, apply cultural competence to the work that you are doing. So build that trust. Leverage the strengths that occur within rural communities, all right? So some of these informal networks are so important. Miss Johnson down the street may just seem like she's a little old sweet lady, but she may be the biggest resource within your community because she knows absolutely everyone. So utilize those resources that already exist within rural communities and respect rural values. You may not be from a rural community, born and raised there. And rural communities are very prideful because individuals often come to us and say, oh, wow, it's so poor down here. What are you guys doing? You all are just so living in this way that just doesn't make any sense. You're not living how we live in other areas. But acknowledge the importance of faith, family, land connectedness, or whatever your particular communities, whatever those values are, and integrate them into their understanding of intimate partner violence and safety and why we need to address this critical issue. And so respect the culture and the values that exist within that rural community and bridge divides, okay? So connect rural values with violent-free relationships and partner with local trusted messengers. Faith sensitivity is also going to be important when we start talking about reality, because many rural communities, is you go to work on a weekend, you go to church on Sundays, right? And not every community, but in many. Okay, so partner with the clergy to reframe religious contexts that have been used to justify abuse. Train faith leaders to recognize the warning signs and make appropriate referrals. Develop faith-based resources if that's important, and create safe space for survivors. Another thing that is important when we start talking about rural communities is mobile advocacy, literally meeting survivors where they are, bringing the transportation to them, creating safety zones such as libraries, health clinics, community centers, bringing technology, documentation assistance, and those resources to the survivors, and also providing flexible schedule accommodations that support rural work patterns. Technology enhanced services is also going to be important as you continue the work that you're doing, such as telehealth, mobile applications, and text-based services where if a person has experienced a compromised voice call, they can text an emergency line to seek out support services. So when you're writing those grants, write them for more telehealth support and more funding for telehealth and mobile applications and text-based services. So also consider, as we think about rural communities, that there is a great digital divide. So one of the things that we need to advocate for is for low bandwidth video counseling safe spaces in community locations, and offer safety planning tools that can be available offline as well as alternative transportation solutions. So community-led volunteer driver networks are going to be so important. Ride partnerships with Uber and Lyft will also help support our survivors get to safety. And mobile service units such as bringing advocacy services directly to those remote locations that are isolated geographically, and seeking out funding for transportation services by offering gas card, vehicle repair assistance, and ride share vouchers to win individuals who have survivor mobility issues. Also, something that we can think about when it comes to solutions-based or solutions forward activities that we can do within our organizations, create safe houses for women in communities, and hotel voucher programs, and community land trusts that focus on developing survivor-centered housing. So here's a case study of some things that have already been successfully implemented in the White Buffalo Women's Society in the Rosebud Sioux Reservation in South Dakota. They've integrated traditional healing practices with contemporary services. So they've not strayed away from their cultural values, but they've implemented them into healing services. They have trained their community health representatives to be IPV first responders. They've also worked with tribal legal systems to help navigate the judicial complexities that exist within their tribal community. And they've also implemented trauma-informed practices within a cultural framework. So again, when we're working with diverse communities, keep in mind their cultural values are important to them. So how can we use this in safety planning and in the future? Part 4, building coordinated community responses. So this is, again, where we all come in and where we all chip in to help. No agency, not a single one of us individually, has a complete knowledge or resources to impact IPV effectively. So this is why the work that Lacey is doing, Demaya is doing, this is why that work is important, because we are working together as a system to create these survivor-centered responses. So again, each of you may be from diverse parts of this coordinated community. So we will continue to work with law enforcement, judges, probation officers, prosecutors. That's the legal aspect. Victim services, advocates, shelter, crisis line workers, group facilitators, healthcare, emergency departments, primary care survivors, community health, mental health workers, and the faith community, social resources, housing authorities. All these communities are important for us as a collective to address IPV. And so how can we do this? We can do this through the adaptation of coordinated community models. And so this is what we already know, that it's important for us to consistently meet online like we're doing now, to have this shared community where we're knowledge sharing about ways to put forth new ideas, to cross-train, and to maximize resources across county line. Healthcare interventions are going to be a critical point. So again, we can advocate for and promote universal screening by using IPV trauma-informed protocols, by offering onset advocacy, advocating for women who come into the clinic, advocating for survivors who come into the clinic, by offering provider training. Does this doctor know? Does this social worker know? Does this law enforcement officer know? Does this judge know? So providing those trainings within our communities and upholding and uplifting documentation. Document, because if it's not documented, it's often thought that it didn't happen. And by creating law enforcement partnerships, we appreciate our law enforcement officers and those who provide services. So again, shoring up the need for protocols between advocates and officers, all right? And also highlighting the important need for officer wellness resources to mitigate vicarious trauma. Some of the other things that we can do is to have justice with compassion. So we need our legal representatives, those who work in the court system, to be judicious, but also understand the needs of survivors, and right? So have judicial trainings that understand the impact that IPV has on diverse communities and establish remote protective order hearings so that can reduce the transportation barriers and reduce safety risks. So there are many things that can be done within the judicial system to support survivors. Other things that can occur within school partnerships. So those of you who work in school and academic settings, such as the one I work in, I work at the collegiate level. But for those of you who are on the K through 12 level, we can talk about age appropriate, healthy relationships, right? What does that look like for our kids? Hitting and punching. We see this thing. So a lot of times this bullying behavior starts and then it continues on until adulthood. So having this conversation about boundaries and healthy relationships that is age appropriate, right? And sometimes this training just needs to occur in the home. You may not want it in your school systems, but it needs to be occurring because IPV just doesn't pop up, right? It doesn't, a person just doesn't start hitting someone when they get 40 years old or 50 years old. They've been doing this pattern of abuse for many, many, many years. It's been going on for many years. So staff training is also going to be important for teachers and staff to recognize this behavior in the K through 12 system. Social support, safety planning, all of this is going to be necessary. Other things that are truly important include engaging in formal community networks. Again, I've talked about the faith community. And even for those who may not be a part of the faith community, we can all address these issues. Local businesses, employers, EMS services, tribal leaders, cultural leaders. These are all members of the continuum who help to lift up IPV and understand and promote education around this issue. Confidentiality in rural communities is going to be so important. So as you are continuing the work that you do, establish those protocols within your organization that prioritize survivor privacy, informed consent. Let them know what is going to be shared, what will be confidential, with whom, and for how long. And regular training, such as what we're doing now. Conduct those ongoing education, CEU trainings for all partners, including Victims Against Women, the Victims Against Crimes Against Women Act, and help them to understand what HIPAA laws mean and what all of that means. The Violence Against Women Act. Help individuals understand what that really means and why that act was implemented and how it still impacts communities today. Here's another case study that I want us to think about and ponder. In Southwestern Colorado, here's an effective way that coordination occurs within their community. There is a regional approach across multi-counties to pool resources. So this county is limited, we're all limited, but we pool together our resources to help survivors. There's an implementation of a shared electronic system that has strict privacy controls. There is a mobile multidisciplinary team that travels to remote communities. And also in Colorado, there is a cultural adaptations for Native Americans and Hispanic and Latino communities that includes and incorporates their communities into ways to promote, safety. Policy and systems change for rural IPV response. Current policies and funding formulas often disadvantage rural communities through urban-centric approaches. And so what we want to stray away from is applying an urban lens to communities that lens really doesn't cater to. So grant requirements may simply be unrealistic for smaller communities, and populations-based funding formulas fail to account for higher costs. And also there is a shortage of staff in rural areas. And so when individuals are seeking out this grant funding, we have to make sure that there's enough staff to accommodate. So again, what I'm saying here is that we want to assist our rural survivors and we want to use the resources that we have to assist, but we can't necessarily apply a one-size-fits-all approach to the work that we are doing. So again, funding innovations that can help us move the needle forward a little bit. Advocate for funding calculations that are based on distance and size in your particular area. Streamline grant application processes. Work collaboratively on grants. I'm on several grant teams that address student-related issues, but I collaborate interdisciplinary with other, I collaborate across interdisciplinary professions. And flexible funding. look for those funding solutions that require unrestricted funds so that you can get those dollars to the communities that need them the most. Another thing we can talk about and advocate for is for rural transportation, expanding rural public transit, right? Because look at this picture here. This is very isolated. It's often a true example of what rural areas look like. You know, the bus may come through at a certain time on a particular day in these rural communities. And so we need to advocate for more public transit funding dedicated that also can be dedicated toward providing a safe route for survivors. So implementing emergency transportation vouchers and thinking about insurance and liability framework for volunteer drivers and things of that nature, those who are trying to be a part of the support community. Another thing that is going to be so important as we advance the important work that we're doing is really talking about internet access, which is often a barrier for women seeking support, women seeking refuge or escape from a physically, emotionally, psychological, financially abusive relationship. So we can use our resources to really talk about creating community connectivity hubs that are safe for individuals and their children who are those, particularly in rural areas, who are escaping this abuse. We can also advocate for property rights, zoning reforms, home repair funds, and rural-specific vouchers. And as we start thinking about our Native American communities, we can really work to look at the Violence Against Women Act and fully funding provisions that will support this community, this tribal communities, and work on strengthening tribal court authority over non-Native perpetrators of violence, establish clear jurisdictional protocols within tribal, local, and state communities, and also support culturally grounded intervention programs for all communities. Some things that you can do is to partner with local community colleges on addressing these issues around advocacy and intervention, offer remote training options, and virtual supervision. These things will help clinical support address the issue of burnout. Data collection and rural research is always going to be important because data drives funding. If there are no numbers, then there will be limited funding. So to address the data gaps, we can require geographic identifiers that say, hey, we're conducting research on rural IPV issues, and this is an area of research that is under examined. And so that may flag a reviewer to say, hey, let me pay closer attention to this. And hey, let us put our thinking hats on and think about ways that we can fund this research specifically because it is rural and because it addresses an issue in an underserved locale, geographic locale, but also among individuals who come from underserved, diverse backgrounds. So we can also talk about rural specific funding on program effectiveness. Evaluating our programs is going to always be important. It's always important for us to evaluate the work that we do to make sure we are providing the best services and to support CBPR, community-based participatory research. So research that is led by survivors and not just coming from our voice as judges and lawyers and as social workers and as community leaders on this issue, but it is coming from the community itself. And we can work to create accessible data systems for rural organizations so that we have these perpetrators, documented in multiple areas, and so that individuals can easily access funding, that can easily access websites where they have those resources that are available in these rural communities listed for them. Other things that we can do as a community is to amplify local stories of individuals who are in rural communities who experience this, because when those stories are heard, when that voice and face match, it can drive policy change. Have you ever heard something that was so compelling and it made you want to give, it made you want to support? So we can amplify the local stories. Data visualization, using technology to create a representation of IPV in your community. That helps individuals understand it when we can put our eyes on this problem. Coalition building, exactly what we're all doing on this call today. Forming diverse partnerships to amplify voices that need to be amplified. And being a part of the policy-making decision process is going to always be something that is important to the work that each of us does within our own individual communities. So action planning. What are the next steps for you to take on? What is your role? What do you do? So I want you to take a few minutes to reflect on your specific actions, things that you can take, things that you can do within your particular organization and within your capacity. What can you do to enhance IPV response in your community? What new partnerships could you develop to address intersectional needs, disability needs, needs for the LGBTQIA population, needs for culturally diverse communities, need for all women, individuals, women, men, children, individuals who are survivors of IPV? What trauma-informed or which trauma-informed and culturally responsive approach could you implement? What can you do? Not what can this person do, but what can you do? What can you implement? And how might you strengthen coordinated community response efforts? How can you collaborate? How can we build up and shore up capacity so that we are helping our survivors continue to remain survivors and continue to move forward with their lives? And what policy changes would most benefit rural survivors in your region? How can we do this? How can we address these issues? So these are some things I want you to think about as a homework assignment as you take or glean some information from this session. What can we do next? So the key takeaways that I want us all to keep in mind and to remember: rural communities, as you already know, face unique barriers. Rural IPV survivors face distinct geographic, meaning where they're located, social. There's no privacy almost. Everyone knows everyone's business, and you are trying to seek confidentiality and safety, and someone may just go and tell. And cultural barriers, language barriers, issues around intersectionality. And it requires us, those of us who are committed to this work, to adopt specialized approaches. We're not putting what's done in urban communities or metropolitan communities on rural communities, but we're looking at it from a very special lens. Policy change. We have to be creators of change by advocating for policy and rural-specific interventions and formulas to help our rural survivors. Intersectionality is important. We must address and consider race, poverty, and all of the intersectional identities and how that shapes the survivor experience. We cannot negate that. Trauma-informed care. All rural services must recognize that trauma does impact a person's lived experience, but we also want to honor survivor autonomy and build on their strengths. And coordinated response, what we're doing today. No single agency on this call, not me, not you singularly, can address rural IPV alone. We must collaborate across systems to create safety nets despite the distance and despite the challenges that we know exist within rural communities. Here are some resources for us as we think about ways to address that homework assignment, think about what we can do. And these are some resources. This is my contact information. And I did have an additional slide, but I'll go back to my beginning slide. But I thank you so much for the opportunity to speak and share with you today. And I appreciate and applaud you for the wonderful work that you are doing and continue to do. And I lift you up as you continue to engage in the area of safety planning and abuse prevention for all survivors. So thank you so much for listening, and thank you for being on the call today.
Thank you so much, Dr. Woods. I really, really took a lot away from that. I loved how you said culture shapes one's perception of abuse. I think that was very important for us to take away. We do have one question in the chat. It says, can you elaborate on what centering lived experiences means, particularly in co-governing spaces such as government and community-based organizations?
Well, for example, and thank you, Demaya. Thank you so much. I appreciate your feedback. And thank you all in the chat. I see everybody in the chat. But when we talk about centering lived experiences, I'm going to ask you, and I'm not sure who asked that question, but just think about your own life. What is your lived experience? What have you gone through? What have you experienced in your own life? That issue or whatever those issues are important. And perhaps no one in the world, someone may have had a similar experience to your experience, but your lived experience is so important, right? Because it shapes who you are, what you've gone through. If you, as you've heard me mention, I'm from the Mississippi Delta. I come from a rural community. All of those different things those things have shaped my lived experience. And so when we think about it in the context of survivors, what are their lived experience, right? What are their lived experiences? Have they lived with financial support, resources, access to education, access to many wonderful, beautiful things, but are still living in a, abusive relationship? Or have they come from an environment where there is a lot of generational poverty or lack of education and lack of resources? So that person's lived experience colors how they may reach out, colors their experience, and it shapes how they may actually perceive themselves. They may not even see themselves as a person who is a victim or a person who is, maybe they have a negative perception of themselves. But I'm not sure what you mean by in the context of the government situation. But what I'm really saying is that our lived experiences as individuals do shape how we respond and how we react. And so this is true for our survivors as well.
Thank you. I was just wondering, so you talked a little bit about how there's this wariness and reluctance in rural communities. What have you seen in your practice, or what recommendations do you have that you can provide for practitioners who are currently experiencing where there's this everyone knows everyone's small community, or where by the individuals that they're working with are just kind of reluctant and weary to kind of work with outsiders? The recommendations, can you speak to that a little bit more?
Well, it's understandable. And I think, as social work, and I'm a social work educator, I'll say that for one. And so I often teach on these issues. And I'm not really, in the community doing the work, but I'm often telling or advising or giving consultation on how we can best serve our populations. And I think the important thing to do, number one, is to acknowledge people's feelings and not to just dismiss it. It's always important. It's easy to dismiss and just say, okay, well, can you get over that? And you need these services. But it's important to acknowledge feelings and to understand where that individual or those individuals may be coming from and what that reluctance is about. And I often think once you're able to really understand and ask some questions and probe a little bit, so what are your thoughts? And where I heard you say this. So where is that coming from? Then once you come and leave from a place of I'm trying to understand what you're saying and I hear you exactly, you probably can be able to offer more services to those individuals. All right. And I think you asked me questions about burnout. How can we help providers avoid burnout in a sense? Well, the work that we do, and I think everyone on here is a practitioner, and to a great degree, it comes with the territory. But it's important for us to really shore up, getting your mental support, walking away from things that become too close to your heart, for example. And it doesn't mean that you don't offer support to survivors or to the individuals that you are serving, but sometimes transference and counter transference can occur. And so it's important to be aware of those issues and to just operate from a place of self-awareness and have supports around you so that if your friends or neighbors are seeing you get burned out, they're tugging you on your coattail a little bit and saying, hey, it might be good for you to pause or to take a break from this assignment or come back at a later point. And oftentimes we don't have to stop the work that we're going to do, but it is important to take those breaks. And some things that I do, I exercise, I walk, I see things, and I try to be involved. But if it becomes a little bit too overwhelming, I know how to say, okay, my self-care is going to be important. I'm going to need to pause here. And we have to do that for ourselves.
Awesome. Well, thank you so much. I don't see any further questions in the chat or in the Q&A box. So I just want to say thank you again so much for your work, for your dedication and your education of us in this wonderful topic about working with rural survivors. I will go back to our screen. All right. So the Institute for Coordinated Community Response is also powered by the Conference on Crimes Against Women, which also powers the National Training Center on Crimes Against Women. We have an upcoming training, Leadership Excellence in Crisis Response, Advanced Training for Domestic and Sexual Violence Hotline Support. This is an exclusive training for hotline support staff, and it is $25. It's all virtual, so this is a great place for you to click on the QR code to register. It is July 23rd from 9:30 a.m. to 4 p.m. Central Time. Also, if you have not registered, register for the Cacao Summit Beyond the Bounds. It is on the beach, September 22nd to the 23rd. It is for your rural practitioner, working with coastal cities, rural communities, looking at aquatic commerce, trafficking, 911 reporting, very geared towards your rural, your resort, and your coastal communities. All right. So that's the end of our webinar. And I thank you all so much for joining us today. And I hope you all have a wonderful rest of your day.
Thank you all. Thank you, Lacey and Demaya. Thank you, everyone.
You're welcome. Thank you.
Thank you.